So you can start.
Yeah. Very good afternoon to the chair, and thanks to the organizers for the opportunity. Today I'll be walking through a case of extraordinary case report on a cardiorenal syndrome and its ocular manifestation. We'll first understand what is cardiorenal syndrome. Cardiorenal syndrome encompasses a spectrum of disorders involving both heart and the kidney. Acute or chronic dysfunction in one organ induces acute or chronic dysfunction in the other organ. The eye shares similarities with the kidney, suggesting that kidney disease and ocular diseases may be closely linked. If you see on the flow chart on the right side, you see those white and light blue color arrow that says that the triggers which are there, maybe smoking, dyslipidemia, glucose, increased blood pressure, thereby leading on to an endothelial dysfunction. That translates into the microvascular dysfunction in the form of reduced vasodilator response, increased platelet activity, rarefaction, remodeling, and fibrinolysis, leading on to the end organ dysfunction and damage. Mainly on the kidney, it can reduce the GFR, leading on to albuminuria. On the heart, it may lead to coronary artery disease, left ventricular heart failure. Brain, it can cause stroke and small vessel disease. Eye, what we are concerned, it can cause retinopathy or choroidopathy. Understanding the pathomechanism of the cardiorenal syndrome, you see the oxidative stress and inflammation. There is upregulation leading on to renin-angiotensin increase and the increase in the sympathetic nervous system, which in turn reduces the natriuretic peptide, reducing the nitric oxide secretion, increased wall thickening, and reduced elastic fiber in the endothelium, thereby causing on vasoconstriction, increased vascular resistance, plaque formation, and venous congestion. This translates into increased sodium transporters, extracellular matrix deposition increase, leading on to decreased renal perfusion, decreased renal output, and sodium retention. On the heart, it will lead on to increased myocyte hypertrophy, increased extracellular matrix deposition, reduce myocardial perfusion and cardiac output. That was for cardiorenal syndrome. Because vascular for this thing is also there in the eye, similar changes can happen in the eye, which I will be enumerating in the subsequent slides. We go through a case report. We had a 28-year-old male patient who was a plumber who was having diabetes mellitus type 1 since 12 years. He was also having decompensated cardiomyopathy, which was diagnosed since 2 years. He had a chronic kidney disease since 1 year, and recently he was diagnosed to have cardiorenal syndrome. The patient was referred for a routine eye examination. Patient had no specific eye complaints. On evaluation, right eye vision was 6.9 NAP and 6.12 with pinhole improving to 6.9 in the left eye. Anterior segment was unremarkable. Going on the fundus photography, both the eyes had proliferative diabetic retinopathy changes, grade 2 hypertensive retinopathy changes. On the right side, you see the pre-retinal hemorrhages along the superior temporal arcade, which is bled from the proliferations. Going on to the OCT findings, it was unremarkable, but for those hard exudates, and there is no RNFL changes. Coming to the discussion, diabetes and cardiovascular disease go hand in hand. Alteration in microvascular structure and function contributes to disease progression to involve eyes, kidney, and heart. The glomerulus present in the kidney and the choroid have extensive vascular network of similar structure. The inner retina and the glomerular filtration barrier shares similar developmental pathway, and renin-angiotensin system hormonal cascade is found both in kidney and eyes. We are at advantage for the reason that we can directly visualize the microvascular changes in the retina, which reflects in turn similar changes occurring in cardiorenal syndrome. As we go on to the panel down, you see the kidney and the eye both has fenestrated endothelial network, and in the eye you have the Brooks membrane. In the kidney you have the glomerular basement membrane and the podocyte in the kidney, whereas we have the retinal pigment epithelium surrounding the endothelium, the fenestrations. So to conclude, there is an upregulation of the humoral signaling leading on to cytokine secretion, leading on to solute free water excretion and sodium excretion. This in conjunction with the aldosterone and atrial natriuretic peptide and arginine vasopressin and the sympathetic pathway it leads on to what is called as the peripheral vasoconstriction. In the heart, it can cause ischemic cardiomyopathy or arrhythmias. In the kidney, it can cause renal hypoperfusion and causing tubular toxicity, decreased GFR, decreased oxygen delivery, diuretic resistance, necrosis, apoptosis, and organ edema. As far as eye is concerned, on the bottom panel you can see there is endothelial damage leading on to the vasoproliferations, and that can lead on to bleeding. On the contrary, OCT angio can show the vascular dropout. As we can see in the normal one and the CKD patient, there is CNP areas. Thus, to conclude, the importance of eye examination in a case of cardiorenal syndrome is emphasized, which helps to timely diagnose and manage the patient. This patient, we had advised the PRP and follow. Thanks for the opportunity.
Thank you, sir. I wanted to ask, labeling the patient as cardiorenal syndrome, does it change anything in the management? Because it looks like a proliferative diabetic case to me.
Yes, sir. This patient, if you know, sir, because the patient was asymptomatic, sir, it was referred elsewhere from being diagnosed as cardiorenal syndrome. And once we had a look into the fundus, we picked up all these changes. So we should be mindful of ocular changes in a case of cardiorenal syndrome. And the duration of diabetes is hardly 1 decade, sir. And as we know, it takes much more longer time for this much of proliferation and bleeding to occur. So maybe there is an early proliferation and the bleed in these patients.
I can see there was vitreous hemorrhage. There was some hemorrhage in the right eye, but patient was asymptomatic.
Yes, sir, because the central area was normal. 6/9 vision in the right eye and 6/12 improving to 6/9 in the other eye.
Okay. Okay. Thank you.
Yes, thank you.